Hello, everybody. Welcome to the Rotary Club of Seattle, where we are continuing to work to build healthy communities. My name is Jan Levy, and this is my 6th month as your president. You were all talking about home remedies. My father used to make us gargle. If we had a sore throat, we would dissolve aspirin in a glass of hot water. And then you had to gargle with it and hold it in your throat as long as you could before you swallowed it. And guess what? It actually worked. So as we're beginning our program today, please take a look at our land acknowledgement, which is up on your screen. At this time, we're going to have a little music. You do not have to stand. Please welcome Linda Ruff, Vicki Oxley, Rick Russell, and Dr. Kia Sams for a bit of Mozart, and they will be followed by Charlie Dickey with our inspiration.
Have you heard of the Mozart effect? Well, then you would know that Mozart makes you healthier and reduces all your stress, and best of all, has cognitive benefits for anybody that's older. Thus, Vicki, Rick, Kia, and I bring you the Cosi Trio, from Cosi fan tutte by Mozart. Yeah. Oh, wait a minute. Do you want to know what the words mean? Because it's in Italian. Here's Rick to tell you.
Essentially, the words mean, may you go safely and have gentle breezes carrying you on your ship. And it's two women, two lovely young women, and an older gentleman that are singing this to the young women's lovers who are going off to war on a ship. So they're praying for a safe passage.
Soave sia vento, tranquilla sia l'onda, e il vento benigno risponda ai nostri gesi. Soave sia il vento, tranquilla sia l'onda, ed elemento benigno risponda
Wow. And now I'm supposed to follow that with an inspirational word or two. That's lovely. Absolutely lovely. President Jan, my fellow Rotary members, guests, isn't it true that in the depths of adversity, we often discover our most inspirational moments? Michael Jordan was cut from his high school basketball team. Megan Rapinoe tore her ACL twice before winning 2 World Cup titles and an Olympic gold. And 2 weeks ago, Liz Cheney, derided for confronting her party, rose to passionately eulogize her father as both a leader and a dad, even reminding us that he was, mind you, a Yale flunk out. These men and women, and too many others to list, inspire me. These men, and like most of you, I look at my own far less glorious but equally galvanizing moments that arose from setbacks. In 2012, I fell hard skiing at Crystal. A slab of spring snow grabbed my left leg and tore my Achilles tendon. 2 months later, summer plans amok, I heard an appeal delivered from this podium. Could one more Rotarian join an exploratory trip to Tanzania to see malaria firsthand? I jumped and said yes. There I witnessed a resource-constrained public health system fighting to deliver life-saving treatments. And 13 years later, 10 malaria project trips taken, 60 locally led Rotary small grants launched, 4 East African district conferences attended, and one pivotal relationship with the Gates Foundation formed. Even a conversation with Tanzanian President Kikwete, an early champion of modern malaria control. And to think that all of this because of a ruptured Achilles. And let's talk competitive sports. Oh my gosh, nothing inspires me more than a little failure. In my middle years, I dove into competitive cycling, at first desperately clinging to the back of the peloton, usually to be dispatched after a few too many intensities, again and again. But embracing the adage that success begins as soon as you try once more, I learned that small victories mattered. A top 10 finish, jumping into the breakaway, or simply finishing with the pack. Then came 2015, completed the annual 104-mile El Tour de Tucson in 3rd place in a large field of 60 plussers, age 60 plussers. And in 2017, a 3,800-mile cross-country ride in 46 days, right to my mother's doorstep. Bending ABC's Wide World of Sports once famous catchphrase, the thrill of that victory alone far exceeded the agony of many defeats. So just 13 weeks ago, a teeny, furtive, bloodthirsty deer tick in the woods near Portland, Maine, bit me. Lyme disease set in, one of over 4,000 cases in that state alone. Physicians at Virginia Mason, perplexed by the diagnosis, hospitalized me for 10 days. I've recovered. However, this little adversity has fueled my resolve to knock off a few storied climbs next summer in the French Alps. Another inspiration born from a setback. President Jan?
Thank you, Linda, Vicky, Rick, and Kia for the Mozart. That was fabulous. And I think that's my first time seeing a standing O for music. So bravo and brava. And thank you, Charlie, for inspiring us. I also want to thank Tracy Brown, Andrew Doran, and Allison Webble for being greeters today, to Pete Delaney for our meeting reporting, and I think Jeff Parker was up there greeting people too. Before we hear from SRSF for our short program, we do have some guests and visiting Rotarians with us today. As I call your name, if I can find them, will you stand and hold your applause till the end, please? Chris Longnecker, guest of Allison Webble. Rick Russell, guest of Linda Ruff. Dr. Kia Sams, guest of Linda Ruff. Philip Oxley, guest of Vicky Oxley. Mahalia Gale, Barbara Stewart, guest of Burr Stewart. Facility Wang, guest of Asunta Ing. Rob Weissman, guest of Nicole Klein. Brad Brickman, Camille Renaud, prospective member. Letitia Johnson, prospective member, guest of Susan Zafir. Patty Chow, prospective member. John Rice. Masahiro Nakashima, prospective member. Thank you all for being here. Please give everyone a warm welcome. So not only are we at the midpoint of my year as president, we are also at the midpoint of our SRSF campaign. Please join me in welcoming David Bobanek to the podium and Cindy Sherrick, who will help him out with an update. Thanks to both of you.
Thanks, Jan. Yeah, I am all for opera at the meetings. That was fantastic. That was wonderful. We should do that more often. So as Jan mentioned, the SRSF campaign is now in its third month. And thanks to the generosity of many of you in this room, we're very nearly at our financial goal for the year. However, they're still not quite at the halfway point for club member participation. So we're going to be extending Carl Banke's very generous match to encourage those of you who have not participated to do so now. To refresh your memory on the match, we have some slides up for you. Carl is going to be matching all new gifts, and that's from new members who have recently joined. Your gift will be matched 1-to-1. There's a $200 difference between gifts from the previous minimum of $400 to the new stretch minimum of $600. Carl will be matching that $200. And then the difference between new Pinkham and Skeel $1,000 givers, gifts, and a previous gift. So again, a round of applause. Carl, thank you so much for your generosity. Okay, and if you still need to join us and make a donation, there's a QR code on the screen. You can also easily make the donation via the club's website. And I believe there may be a takeaway for you as well that you can use. So please do that. We also still accept checks. It doesn't have to be in an electronic form, but we ended the practice of bartering chickens. So we're not doing that anymore. It's either a check or electronic. Finally, two things to remember. If you made the gift before July 1 of 2025, your gift counted last year because with the gifts, we're doing it on a Rotary fiscal year. And you can make a pledge if you'd like to make a financial donation in 2026 now. So lots of ways to give, lots of opportunities for you. And please, we do appreciate as high a member participation as we can have. Another thing to talk about is the Rotary Foundation. So the Rotary Foundation is different than the Seattle Rotary Service Foundation. The Rotary Foundation is a part of the work that is done by Rotary across the world. In order for us to partner with a number of other clubs, we need to be at a certain percentage of our members who are participating and have donated it in the Rotary Foundation. So if we'd like to unlock that district matching possibility, we need at least 60% of our membership to donate to TRF. Right now, we are at 15%. So please do donate to both SRSF. And if you've not yet done so, please remember TRF, because that has a remarkable impact. If any of you have traveled in the world, done Rotary projects, you know the important and really powerful impact that is being made in communities around the globe being done by TRF funding. Okay, so that's more than enough from me. Now we'd like to take a moment to hear from some of our fellow members why they give to Seattle Rotary Service Foundation. Cindy Sherrick is in the audience and has a mic, and she's going to help introduce a few folks now. So Cindy, to you.
Thank you. Lorna,
Thanks.
why do you give to SRSF?
Thank you. I give because it's my core value. I believe that it's more of a blessing to me to give than actually to receive. And it's now scientifically actually proven that when you give, you increase your happy hormones, your longevity, and your existence is better off. The second aspect why I give, I can't miss the opportunity to be part of the multiplier effect that happens when you give through an organization like Rotary. I have seen firsthand how Rotarians all over the world, what we have given has made a difference. We're living at a time when we are close to actually eradicating some things, where kids born in a few decades will be asking, what was that thing called polio? Or what is that thing called malaria? All those efforts are done with the collective efforts of Rotarians like yourselves and globally as well. But I also believe it's the right thing to do. We live in a world now, more than ever, where our existence is codependent on other people. We know about climate change, we know about food insecurity, and it's not the people we give to that it affects, it's ourselves as well. So if we give, we are also improving our lives, and we have the opportunity to leave this planet better than we found it for the generations to come.
Okay. Okay, and now we're going to hear from Neil McReynolds. Neil?
Thank you. I'm happy to speak to the foundation since it's been contributing a long time, and I just think what it's done over the years. And I think our board of the foundation has done a wonderful job of allocating this money to lots of good causes, from locally here where we live and work, to things abroad through Rotary International. And I think it's something to think about, thinking about the needs of the world. There are many of them, but we need to step up to these things. Certainly things right here in this downtown Seattle, we have lots of examples. We don't have to go very far to figure that one out. So and the foundation is addressing that issue. Same with when you travel abroad, you certainly see it. Whether you're on a Rotary mission or you're on other kinds of trips, you certainly see lots of needs abroad. So we're doing that as well. So I think it's a great opportunity and easily to take care of through your contributions. Yeah.
Steve, why do you give to SRSF?
Well, I've been in the club for almost 20 years now and have looked at the impact of the grants that get consistently made over the years. And I think the SRF organization just does a fabulous job of getting the money to individuals and groups that need it much more than I. And I've always felt great about where that money goes. I think it's a wonderful community builder, and it certainly grows the impact that we have in this community in a big way. And it's always been a great thing to give to.
I am Ryan Pong, and I think that you've already heard all the great reasons to give, and mine are very similar. One, it's the right thing to do. We all know that sharing, when you have something to share with somebody else, makes you a better person and makes you feel good about that. That's really, really important. One, two, it's the right thing to do. When we all signed up for Rotary, it was part of the compact that we all agreed to, that we would be giving to this foundation as part of our membership and the expectation of supporting that. And three, really the reason I enjoy giving is because of all of you. We are in a room with really smart, intelligent people. And especially at this time of year, you're probably bombarded with all these flyers of please donate to this and please donate to that. I think when you give to this foundation, you know where it's going and you know that it's been vetted and you know that it's a really good cause. And if you need more information, you can always read the annual reports. And it's just fantastic to be a little part of that. So thank you for the opportunity.
Thank you.
Thank you, everybody. Ryan, thank you. Jan, back to you.
Thank you. Today, we're beginning our exploration of our next element in the healthy community, health and wellness. When we talk about community health, it's about far more than medical care. It's shaped by a wide range of factors, from social and economic stability to the environments we live and work in, to our behaviors, and the policies that structure our daily lives. As Rotarians, we talk a lot about service, we just did, connection, and the ways we can strengthen our community. But at the heart of all of that is something very simple: people's well-being. Access to excellent health and the encouragement to live healthy lives aren't just policy ideals. They're what allow us to thrive. Today, we're joined by someone who brings both expertise and genuine care to his work: Washington State Secretary of Health, Dennis Worsham. I first met Dennis when he served on the Leadership Tomorrow Curriculum Committee. And no, he's not a graduate, unfortunately. He has spent his career focused on helping communities stay healthy, especially those who have been traditionally underserved. His bio is on the table for you. Dennis will share his insights, his experience, and his vision for a healthier Washington. Please join me in welcoming Secretary of Health, Dennis Worsham, to the podium.
Well, I feel like I'm in a public health meeting. We've talked about malaria, we've talked about Lyme disease, bike riding, the science behind giving. So my work is pretty close to being done here. It's really an honor to be here. And of course, as many of you know, Jan, nobody says no. And I got a phone call soon after I got first appointed, and Jan goes, "I need to get you on my schedule." And so we worked out a time that would to be here, and I'm really grateful for the opportunity to be here and to learn a little bit more about your club and the good work that you do. I'm going to have a little bit of slides. I put way more slides together because I wanted to pull to the element of just health and well-being, since it's part of the work that you're doing, but it's also, I've been appointed in my role as the Secretary of Health in July, and it has been a ride, to say the least, for between now and then. And I'm going to talk a little bit about my first 100 days plus, kind of what I've seen, learned, and all the things that have taken place. Context always matters about who we are, where we're from, and a little bit about what shines on, influences me as an individual and a human being. So I just want to real quickly give you a little bit more. She's talked about my long-term career in public health, but I grew up in a small farming town in Eastern Washington, a little town called Othello. And I was first in my family to go to college. I had no idea what that might look like for me. I come from my dad's side of the family were farmers. My mom's side of the family worked in the railroad. And in a small town, your exposure to people with education are one of two things. They're either in the teaching in the schools or they're in the medical community. And academics were not my favorite. So I was like, not that way. So I'll move a little more towards the healthcare side, and did my degree up in Eastern Washington University, and was graduated from there with Health Services Administration. This was in the early 90s. At the same time, I came out as a gay man. And if you remember back into the early 90s, it was also the middle of the HIV epidemic. And coming into a community where people were dying of my own age at a rapid pace, and the federal government at the time was slow to respond to that disease. And I felt a call to do something in the community in which I was coming out. So I moved moved over to the western part of the state and began my journey in public health in the early 90s up in Snohomish County doing HIV prevention and education. And 32 years later, I'm in this current role. I've served most of my time in Snohomish County, also in King County, and was the deputy secretary for a period of time before coming back. I thought it was going to be a great gig, come back to King County, and my background really is in infectious diseases, and so I thought this will be the way I'll end my career. It'll be great. Had a team of about 200 people, and of course, we were the first to be hit with COVID, and so all of a sudden it was like, you're on and the world is watching. And so I ended up being the director of King County Public Health. So a little of my slides are from that time period, and then I'll move quickly on to what I'm experiencing today. So that's a little bit about who I am. I have to say, knowing Jan so well, when I saw the elements of a healthy community, I'm like, this has Jan written all over it. And I love this framework. And it's one of the reasons I joined the curriculum committee and was served on that for quite some time, is because health really is in all policies. If you have good transportation, it's good health. If you have good housing, it's good health. If you have economic viability in a community, it's good health for the people who live in those communities. So this is really a testament to my own belief system about what makes an element. And of course, today we're talking about wellness. I'm not going to do this exercise, but I just wanted to point this out. I oftentimes will do this when people are maybe not working in the healthcare area or the public health arena. I usually start with this slide and to say, if you could imagine this pie chart, and if you were to look at the 4 things that really influence health, from your healthcare access to your lifestyle and behaviors, to your genetics, or to the environment, both your physical and social environments in which you operate, live, and play. What are the things that really determine your health the most? And to some people's surprise, that health care is actually only 10% of what really makes up your access to health and well-being, that there's so many other things that really contribute to that. And I think it's one of my draws to the public health world is it's important to have access to good healthcare and good quality healthcare, especially I'll talk about what's going on in today's climate, but these social and economic factors and health behaviors really are big drivers in where we're at. This is a slide. I just, when I saw this slide a few years back, it just was really a hard hit for me. And if you were to look at this slide, and it's about life expectancy, how long do we live as a country, as human beings in the United States? And if you look at the investments or per capita cost of what gets paid into the healthcare system, is we put more money into our healthcare system than any other developed country in the world. And as you can see, the outcomes of longevity and life expectancy is much higher in the other ones. So you always have to ask the question is, why is it we put more into the healthcare system and we have one of the poorer health outcomes when we talk about longevity? And of course, the number of things that we've already talked around that shape your health. These are what in public health we call heat maps. And this is one that we put together a few years back. And it really was, if we were to look at life expectancy in King County, that there is a wide variety of life expectancy from the people who live generally in the South County area to people who live in the North County area. In fact, if you were to do a bike ride, Charlie, from a short bike ride for you, from Auburn to Mercer Island, there's a 10 to 12 year life expectancy difference between those two communities. And it's just based on where you're at. So there's a term we oftentimes use in public health is actually your zip code is more a determinant about your longevity than actually anything else. So if I were to pull this out, this kind of packs it out, is this heat map looks basically the same no matter what I look at. If I look at poor housing conditions, if I look at tobacco use, if I look at diabetes, obesity, lack of physical activity, there is a correlation to these types of things that really provide to where we're at with longevity. So place does matter, and the work that you're doing and the contributions that you make to really developing healthy communities has an impact all the way across. I'm not going to spend much time on this slide. We oftentimes talk about social determinants of health, things that determine your health as a human being, as a population health, and these really tie nicely together with your elements of a healthy community. I'm not going to go into the public health piece. One piece I will share here, because I always think it's important because it's going to tie to some of my later comments that are under fire right now, is that if you look at the 10 public health achievements that we have created in this country, really from for the last 100 plus years, is we've gone from a life expectancy of 49 years to over 75. We're pushing close up to about 78 now. And it's really based on sanitation, vaccinations, the control of infectious diseases, and creating more safer work environments through regulations. So I took my role on the beginning of April, as July, as I mentioned, and it was really important in this climate and kind of where things are at was to figure out what's going on across our state and really hear from people in our state about the health and well-being of where we're at. So really engaged with the governmental public health system, which in the state of Washington is made up of tribal health. It's made up of the Department of Health at the state of Washington, local governments, public health, 35 of those across the state, and our state board of health that really drives our governmental public health system. And the other part was really our healthcare system and the well-being. Now, I came, again, from the small town in Eastern Washington, parents aging mid-80s, and we have one critical access hospital in that area, and trying to navigate my own parents' health in a small community around access is really a challenge. And so I really wanted to get out and kind of hear from a variety of folks of where we're at. As I launched my 100 days, I will tell you, I was on an early retirement plan. I was going to retire next year. And I shared with David a little bit earlier before we started is my husband works in New York, and I thought I'm going to retire early, move to New York. We're going to have a couple of years in New York. It's going to be great. And we were, I had too much screen time, which is not a good message on health. And we were on vacation and for celebrating his birthday, and I'm on a beach, and I'm starting to see all the executive orders drop from the administration. And it was this really gut punch for me, especially around the public health pieces and dismantling so many of the things through the executive orders, looking about equity and inclusion, and knowing that those things were all really important to the health and the strides that we have made forward as a country. And it was a fight or flight moment. And so I made that decision to step in the area. I appreciated the song. It was incredibly beautiful. I couldn't help but think of the symbolism of sending people off to war. I'm like, oh, it's a perfect setup for my talk. So I'm off to war. So let me tell you about for you, those that don't know what we do at the Department of Health. It houses our public health system, and that really is a broad topic. We do from infectious diseases, of course, most common and aware for many people is what we do around infections like COVID and around Lyme disease and around how do we interrupt and break those transmissions to really protect the health of the community. And we do things from environmental protection to make sure when you walk into an environment like a restaurant that we have safe water, we have clean food, folks, for people to not be able to get a disease when they show up in those particular places. We do things from vaccinations for prevention services. We do healthy eating, active living. It's a broad book of business, and we house that as a state agency through our Department of Health. The other part that we don't talk about so much is we do have a role in the healthcare arena. We have the three areas of focus of quality, access, and affordability. We regulate all hospitals in the state of Washington, and we provide all licenses and credentialing for all health professionals within the state of Washington. And is how do you take those opportunities and assure that people can have good quality of healthcare, have access to healthcare, and also that it's affordable. So in my tenure in this role, we've seen this convergence of two really challenging pieces. One is the federal government and its really dismantling of the CDC and the governmental public health system just brick by brick. If the court systems hadn't stood in to really stop some of the decay that was happening there, that over 50% of federal workers that work at CDC would be gone. And those are the people responsible for monitoring outbreaks, doing the data that really tells us what we need to do, and really setting policies and practices to getting to good places of health. We've currently now do not have a CDC director. We're fired, and no one has been replaced into that role. And all the top officials who really have led us through things like COVID, avian flu, and other things, all of those positions are now gone. And so people who have led us through these periods of time in uncertainty or through disease outbreaks and monitoring, coordinating across states, and the removal of our connections to the World Health Organization have all been stepped away through the time I've been in this role. Of course, the other challenge that we have here in the state of Washington is we have a really difficult deficit that we're addressing, and it's going to get worse over the next few years. And so we see these kind of collapsing of two areas that really build the infrastructure and importance of the public health system here in Washington. Also, during my 4 months in place, we had a government shutdown, the longest government shutdown we ever had. And of course, that meant really a threat to basic things like food. For people of low income, the SNAP benefits, we provide what we call WIC benefits. It's women, infant, and children to low income women to make sure that they have formula for their babies if they're not nursing, to make sure that they are well fed as parents as well as kids up to 5 years old. All of those funding programs were under threat and to close. We did pivot and were able to keep those open, but it was a really frightening time for us. I've talked a little bit about the dismantling of the public health system. In particular, the attack on vaccines and the science around vaccines has been a major area for us. I'm going to talk a little bit about what we're doing. I'm painting the gloomy picture first. I'll get to some hope here in a minute. And of course, in this time of all the things that are happening with social media and other things, it's just the disinformation about public health and the public health system and about science are really challenging to continue to address, because with AI and other things, it's really hard to know what's true and what's not true, and how do you discern those particular areas, and what is it we can do as a system to really address that. The other part in my 4 months is that as soon as we walked into the position, is we saw actually a 30% reduction in federal funds coming into the state of Washington, and 100 million were immediately cut off from what we called COVID dollars. And the COVID dollars was what we learned during the COVID response, and what we were trying to do and build into the public health system so that if we were to have another pandemic or surge, that we'd be able to respond to that. And we're currently now monitoring 40 grants that about another $200 million that we have been appropriated through legislation but not received the funding yet. So really some tenuous times around some of the funds. As you know, through the HR 1 passing that already happened, Medicaid cuts will have a great impact. 250,000 people will lose their health benefits in the state of Washington because of these Medicaid cuts. Another 150,000 will be priced out. So we're getting close to about 500,000 people who are losing their healthcare coverage that will be reliant on going to emergency rooms and other devices of care, and where we're at. Rural communities in particular are going to be hit harder, and some of our hospitals in these critical access hospitals in these rural communities are 70% of the funds that come into their hospital are really paid through Medicaid. So we have a range of about 5 to 12 hospitals that we potentially will lose with these cuts. I've talked a little bit about WIC. I'm not going to go any deeper with that. This is one of the things that's on the chopping block with the funds that we're monitoring right now. It serves about 212 people. and about 30% of pregnant women in the state of Washington are reliant on WIC funds for their own nutrition and access to healthcare, as well as feeding things. It's a science-based program that has tremendous outcomes in birth outcomes and getting kids ready for school to be ready for school in the academic environment by the time they achieve that. Another one that's on the cutting block is the Overdose to Action Funds. It's really about where we're at in really addressing the fentanyl and overdose crisis. These are slated to be cut that we receive. I'm not going to get into the data too much, but I just want to point out that there is a trend that we've started to see overdose deaths starting to drop across the country, but that is not the same here for us in Washington. We're slower to move that down. And we've seen over 3,000 deaths in 2024 of overdose just in the state of Washington. That's a number that I always want to throw in there. If you've been over to the Paramount Theater, and you've had an opportunity to go there, if every one of these seats were filled and the aisles with standing room only, it still doesn't catch the number of people who died last year of opioid overdose. That's how many people died in the state of Washington. So what are we doing? We are going to always be based on science here in Washington. We have the support and the political will to stay in that space, and we're committed to that, and I'm committed to that during my tenure here. With the dismantling of the ACIP process, which is the advisory committee to the CDC, what happens in the flow, just real quickly, is when a new vaccine comes onto the market, it goes first to the FDA to say it's safe. And then what happens, it goes from FDA to this ACIP process to say who it's recommended that vaccine should be available for. And then oftentimes insurances and public health and availability to pharmacies and other to be able to provide those vaccines in those particular area. With the ACIP disruption, we were really concerned that we would be pulling away from some of the science and moving more to the ideology of what was happening there. And so we started what's called the West Coast Health Alliance. It's the Western states, including Canada, or excuse me, we'd like to include Canada, including Hawaii, and really it's based on making recommendations based in science. With mixed information, we wanted the uniformity to build the trust within the public health system with good science to be able to do this. Instead of really doing the science ourselves, we're really highlighting people who do this work already. You think about the Academy of Pediatrics for over 75 years have been making recommendations, and we're going to hold that science up. The reason I kind of walked you through that map of how it goes from FDA to ACIP is critical because what happened, we saw something different happen in the federal government, and CDC, FDA came out with the COVID vaccine and recommended it and said it was available for 65 and older. Normally, that is not the FDA's role. It's just to say, is it safe or is it not safe? Then ACIP makes the recommendation of where it's at. So we saw starting to shift how policies were being developed at the level. And so in the state of Washington, because we had good public health practice and laws in place, that serves under my role is what we call a state health officer. And we did a standing order, which is basically writing a prescription to say anybody who would like a COVID vaccine can have this prescription to go and get it. Because what happens is when the FDA makes that decision, it puts COVID vaccines for anybody under 65, what's called off-label. Now, a physician can prescribe off-label, but when you go to your pharmacy for a vaccine, a pharmacist cannot give a vaccine that's off-label. And so by putting our standing order in place, it allowed that prescription to be in place for anybody who wanted it to get a vaccine and make that decision. So that was one of the practices that we did. So thank you. Real quickly on vaccines, measles is a major problem. It's in the national news. We have seen a doubling. We've seen a vaccine starting to decline in our populations around kids. We have seen our first deaths last year in measles not in the state of Washington, but across the country. First time we've seen deaths in measles in over 10 years in our country. And we have more than doubled those cases across the country, and we anticipate it's going to get much worse. We also developed what's called the Rural Transformation Plan. This is a response to the Medicaid area. Some federal dollars were made available for us to be able to assure that our critical access hospitals in particular in rural communities would have a path forward. The dollars that are available, that are coming available from the federal government are only a fraction of what was cut. So this is not going to make up our gap, and we're going to have to figure out other ways to do that, but this is at least one plan that we've developed. Our priorities going into the legislative session this year is to maintain our core services within our public health infrastructure, to keep people safe, healthy, and have access to healthcare when they need it and when it's important for them in the state of Washington. We are going to be responding to some of the federal changes happening. Because we've always relied on the CDC and the credibility of the science of the CDC, we have always connected both our insurance through our insurance commission and through our public health and through our laws that our vaccine recommendations are based on ACIP. We're having to decouple that because of the concern that things are going to change in those major areas. So we will be decoupling that through policy at the state level. I'll just leave this with Helen Keller. I think this is preaching to the choir here as an organization that has been around and existing as Rotaries, of people, Rotarians, that, the importance of the collective impact is really important. So alone, we can do little things, but together we can do so much. And I really appreciate the opportunity to be here, kind of raise the concerns that I have and what I'm seeing. It's been really an incredibly 4 months from federal shutdowns to response to the federal government in those areas. But I will tell you, I feel like it's a calling, and I'm at the right place at the right time, and looking forward to partnering with people in our community to really help get this message out. So thank you so much.
Thank you. We have time for very short questions because he does have to get going, and we do have a little gift for you on stage before you zip out. So very short questions that are close to me. So we'll go right here.
Thank you. Why is Washington lagging and preventing opiate deaths?
Yeah, it's a good question. And we don't know for sure, but let me tell you some hypotheses that are not so positive. The state of Washington was really a quick adopter around Narcan, and it's a reversal drug around opioids. And we were an early adopter. We got it in through our paramedics. We got it out through community-based organizations, and we got it out to people who were using to really help prevent overdose deaths. And we have also piloted and had great success with our paramedics is that we start buprenorphine, which is a drug to help people move to sobriety. And we have found through science is if we start them when they've been an overdose and pick them up and get them into a healthcare facility, is that actually they're more likely to move to treatment. And so we're starting to see some good things in those areas. The reason why that is important to say and why it's one of the reasons I think we have not gone down. Other states have not been as aggressive, and some of the people who were most at risk for having overdosed have overdosed and died. And in the state of Washington, we have been very aggressive in overturning some of those overdoses, and so our pool is actually larger. So I think it's part of the successes that we've had here as a group. There is also trends that we see in drug use, and that always, even when fentanyl came in, it starts on the East Coast and moves to the West Coast, and some of the trends around changes also. So a couple ideas of what we're looking at.
Mr. Secretary, quick question over here.
Yes.
Hi. We are all a little concerned about the cutting of the tax subsidies.
Yes.
But then we recently heard in the news that Trump was now open to making the tax subsidies available for at least the next 2 years.
Yeah.
Mainly because he doesn't have a plan anyway. Yeah. So what have you heard about that? What do you think is it going to happen?
Yeah. The devil's in the details, as they say. We'll see what really comes to, we've heard for how many years that we're going to return, Obamacare over and come up with a different plan. We haven't seen that plan. We have about 60,000 people who rely on those subsidies in the state of Washington. And we are trying to pull every lever we can. I'm hopeful I think that was one of the positive things of the shutdown, is that issue got raised quite high. And I think that there are some states who are red states in particular, who also rely on those subsidies, that people are starting to speak up about what the impacts are going to be in those areas. So I think that there are people within the own party that are advocating for those changes as well. So I'm hopeful. I think that at least for a year, we'll have a good path forward here in the state of Washington. But if something doesn't change, second year will be a challenge for us here in Washington.
Thank you, Dennis. And as a thanks for your participation today, our club's foundation, the Seattle Rotary Service Foundation, has provided 600 servings of healthy produce to those in need through Harvest Against Hunger in your name.
Wow.
Thank you again for joining us. And thank you to those of you who have contributed to SRSF. Please do so if you haven't. Thank you.
Yeah, thank you so much.
Thank you again also to REB Enterprises and Carl Benke for their meeting support this year. I want to thank Bloodworks Northwest and the Westland Morris Group and with Baird Private Wealth Management, that is really hard to say, for their sponsorship support. Nicole, got some announcements?
Only two, so I'll go fast. Who remembers the holiday party when it snowed and ice stormed? That was terrifying. We almost got stuck there. This year, we're not having that, I hope. But Monday, December 15th, when we get the newsletter in your inboxes, please register. We all know the really strong drinks that are there. This year, we want you to dress boldly, wear whatever makes you feel festive. We will have a DJ. And whoever dresses the most festive, Jan will be giving out some kind of prize. We don't know what it is. Our next meeting will be Wednesday, December 17th. It'll be here at the WAC, and we have local NBA legend, James Donaldson. So do register early as tickets will go fast. So that will be the last meeting of the year. Okay, thanks.
Thank you, Nicole. And would you all join me for just a minute? Happy birthday to you. Happy birthday to you. Happy birthday, Nicole. Happy birthday to you. Thank you. That was yesterday. A bit of club business before we adjourn. Thank you to all of you who submitted your ballots for next year's officers and board members. They are listed on the screen. If I read them all, you'll never get out of here on time. But very quickly, with those of you who are either a new elected as an officer or a new board member or an SRSF trustee, could you stand and we'll all give us your applause. Thank you for serving. I really appreciate it, especially since I only have 6 months to go. Mahatma Gandhi wrote that it is health that is real wealth and not pieces of gold or silver. Thank you for being here today. I look forward to seeing you at the holiday party on the 15th and at our meeting at the Westin on Wednesday, right here at the WAC on the 17th with NBA player James Donaldson, who is going to be talking about his own mental health journey. We are adjourned.